computer.
Yes, sir.
A very good evening to all of you. Thank you so much for joining in time. In another couple of minutes, we'll be starting up with this small orientation on our fellowship program. Hi, Disha.
Hi, sir. How are you?
I'm fine. How are you?
I'm well. Thank you so much. Looking forward to the orientation.
Yeah, thank you. Just a minute. We'll start off. We always don't waste time. Okay, it's 8:32. It's time to start. So thank you so much for joining in time. We always respect everybody's time. And this was a long pending orientation, which a lot of people have been asking me, what is this fellowship program you guys are offering and what do we benefit? Yeah. 2 weeks back, we had an Instagram live with the four accredited members, including me, telling what it means to us and what is this all about on education on cosmetic dentistry. So today we all know that smile makeover has become an integral part of our day-to-day dentistry. So before that, I'll also like to tell another maximum half an hour. I'll take your time. Then this recording will also be available. Not more than that. I know it's a busy weekday and I don't want to take much of your time. So smile makeovers have become an integral part of every practice, to be very frank. Whichever part of the world you are, whichever part of India you are, everybody wants to have a beautiful smile because the importance of look is grown so much that everybody wants to have a beautiful smile. Like that's a paradigm shift that's happened in our day-to-day practice. Like earlier, there was a necessity for the patients to walk to our office, but today they come and ask, Doctor, can you get this done for me? So it's more of want-based dentistry. So what exactly is this cosmetic dentistry is given by the American Academy of Cosmetic Dentistry, the definition, which clearly means that it is an art and science which optimally improves dental health, aesthetics, and function. So in this, where did we all get our formal education with regard to cosmetic dentistry lies a huge question because cosmetic dentistry is a multi-speciality branch which needs the ortho care, the perio care, and the prosthodontic care along with the restorative care. Obviously, sometimes surgeons, because when you're putting an implant. So it is a team effort. And where did we all go into this comprehensive treatment planning? And where did this all start is a huge question because until I graduated, nothing like this was there. And even now, there are very few institutions which actually offer some fellowship program. But what is the formal education and who has a formal qualification to practice cosmetic dentistry is always a huge question. So who can do? Everybody can do. Who can do implant? Everybody can do implant. So where do we start? Where do we finish is becoming a huge question because so many things are happening today. And we need to somehow standardize this, make sure a patient care is getting the most important aspect of our dentistry. Is our dentistry getting diluted? That also we need to check. So where did this all start is with this dental evolution. So today everybody talks about smile designing. How you do is another question, and digital dentistry. These are the buzzwords in dentistry today, and everybody love to use the term I do smile designing, I'm a digital dentist, I'm a digital smile designer. But eventually, what we all didn't realize that the health took a backseat. So we are forgetting that we are healthcare professionals and it's a mouth-body connection. It's not a tooth that is walking to our office. It's a patient who's walking to our office. It's a complete mouth-body connection. We are working for the well-being of the patient, just not putting some smiles there. Obviously, smiles create a huge impact in the patient's life, but we need to take care of health. Health first, then smile. So it was surprising that I saw this slide in one of the implant presentation wherein obviously it was going on earlier also where people used to tell that anyway a root canal fails and then you put an implant, why don't you put an implant? That's not the point. Today, the whole world is changed. Let's root canal wait. Let's implant wait. Let's go to the last resort later, but not now. So we are trying to avoid root canals. We are doing a lot of biomimetic restoration. And then we are trying to postpone when implants can be done. It's not that at one point of time, we're going to get implant done. Now, that is aggressive dentistry and that is not healthcare service. So somewhere an education has to happen in diagnosis and treatment planning and not in preps and composite placements. It's easy to teach anybody how to do a laminate prep or a crown prep and then go ahead do that is a mechanical job. But how to get this smile into the patient? Will this smile work for the patient? Is this smile really necessary for the patient? No. I don't know if we are even talking about it, because now what has happened is that they are telling that you start with a prepless veneer, then you go to a prep veneer to satisfy the patient, then eventually do some root canal because of sensitivity, and then the root canal fails, and then you put an implant. That's how people are talking about. Are we this group of dentists? No, we are not this group of dentists. Obviously, don't be surprised. I'll show my case here. So this is a patient who walks to me and tells that, Doc, can you get this four teeth out of my mouth? It's creating a havoc. I'm having pain. My head is aching. So I asked at that point of pain, we're not supposed to irritate the patient by taking pictures or something. So quickly took some initial records, then asked, removed everything and asked the patient what went wrong. So the patient tells me I was supposed to get married and I had these small diastema between my incisors and I got it done. Got done what? Some irreversible dentistry. So four crowns was done. So where did the education to do this come from is a huge question now that makes us think, are we in the right line or what are we doing right now? Because somebody has thought of closing the diastema with four crowns is not the right way of doing it. The reason I'll tell you, it's very simple, guys. The media has influenced a lot of things in our life. And then today, this is a statement which all of us need to accept, that it's easy to sell wrong dentistry rather than right dentistry. So why has this happened? Guys, please remember we are living in a very different world today, thanks to us, because we did this innovation and we need to take care of what's happening around us. Today, AI, ChatGPT, everybody has that, and that has dominated the field, our field, and every damn field in this planet Earth. So, coming on to treatment planning, maybe I would accept this easy to sell wrong dentistry. Yes, but now it's not that. Slowly, we will see that patients are going to go lesser and lesser for second opinions, because you know something, they can just access your chat GPT, Google Gemini to find out what's happening. They get validated about our treatment plan with 1 second in chat GPT. All they have to do is come to you, get a treatment plan from you, take a photograph, put it onto the chat GPT, just give me a second and look what's happening. So we are leading a tough life, guys. It's not that there somebody's going to come and sue us. We are not reached a stage, but patients will now have to just upload one picture and then see what's happening. So yeah, look at that. It's getting loaded, and that's all. It's where are we today? So patient are going to get just the validation of our treatment from this. Look at that. Till phase 4, it goes on and on and on. So unfortunately, we are so educated and patient still believes what's coming up in the Gemini or Chat GPT. Now it is so difficult to tell the patient, come on, that's not right. What we are telling is right. So the era we are practicing is really, really painful, to be very frank. In that, if we come across failures, it's going to be more and more painful because patients' demand has increased. So that tells I don't want failure. So where do I start smile makeovers is that I don't want to see failures. I don't want to see my laminate breaking. I don't want to see my resin discoloring. I don't want my patient coming back with plaque accumulation. I don't want my health of the patient to get deteriorated. So this is where we actually start. I make sure that the structure is good, the biology perio is good, deciding factor is good, that's occlusion. If possible, then I fit a smile for the patient. If that's not possible, I'm not fitting the smile for the patient. Simple as that. You have a beautiful smile, but nothing is working out. The patient will tell, doc, get this off. Get this off from me. but everything else is okay and still they don't have a smile, they can live. Guys, there's a difference between life and lifestyle. Please understand that. So the education of structural integrity comes from the Department of Conservative Dentistry, biology comes from the periodontium, occlusion, every department comes to occlusion. So that's why I told it's a multi-speciality. So everyday dentistry revolves around the structural integrity. That is the patient coming with tooth issues, the patient coming with perio issues. So this is day-to-day dentistry. How does it survive? If occlusion is taken care, then everything else survives. Otherwise, nothing survives. In this given chance, if I could give a smile to this patient, I give, otherwise I don't give. At the cost of giving a smile, if I want to reduce tooth structure, no, I'm not going to do that. If I'm not going to do for me, I'm not going to do for anybody. So please understand that how much of structural integrity are you going to save after procedure? What is the biological interface that's going to happen with your restorative dentistry? Are you able to balance the stomatognathing system? Then take up the case. In ethics or ethical medical practice, we tell that doing the right thing for the patient. Yes, but today cosmetic is not related only to dentistry, guys. You know what's happening around the globe. Every damn field in medical profession is also having something to do with cosmetics. When you come to cosmetics, the field of cosmetics, we are all dentists. You know what is ethics in cosmetic dentistry? Telling the patient that you don't need the treatment. That is ethics. Because here is a situation, a funny situation wherein a patient is ready to pay us and you're telling, keep your money. I don't want your money. Your health is more important for us. So this is ethics because we revolve around risk-based treatment planning. What is the biological? If I do this treatment, what is the biological risk? What happens to the remaining tooth structure? How is the function going to happen? Is the patient going to happily eat, sleep, talk? Then talk about smile. So in this, there are academies which came up to give us what is cosmetic dentistry. And the only global academy which came forward with a credentialing is the American Academy of Cosmetic Dentistry. So this is a 40-year organization window to the soul, which has this beautiful credentialing done. Dentistries are calling. If you really want a glimpse into someone's soul, it's their smile you should be looking for. We take the smile seriously. It is, after all, our business. We are dental professionals, and passionate ones at that. The smile is our life's work. The American Academy of Cosmetic Dentistry raises the bar with their proven protocol of continuing education. And AACD is the only aesthetic dental organization that offers an advanced credential. We've been leading the way for more than 35 years. Maybe that's what makes us mavericks. We don't necessarily see it that way. What we see are people coming through our doors. Some of those people have something locked inside that hasn't quite found a way out. We have the power to help bring it out. Brightly, soulfully, vividly, truthfully. We help bring it out. So, this academy offers an advanced credentialing program, which is set global standards in the field of education and cosmetic dentistry. So this is the only global organization which offers that, and it is globally recognized. So they set a curriculum for the field of cosmetic dentistry, and it's 40 years old, guys. It's amazing. It's amazing that they started this, and today anywhere you go and tell that I'm an accredited member of the American Academy of Cosmetic Dentistry, they give you nothing else is needed in your biodata. That simply means that you're a dentist with some sort of responsibility. So it's just not about smile. We offer hope, self-confidence, and happiness. So it's a nice credentialing. Just listen to this.
I remember my first AACD coming in and looking at some of these educators and looking at their cases and thinking, this is beautiful dentistry. And I don't know if I can ever achieve this, if I can do it, but I'm going to try.
I always knew that the ACD accreditation was something that I wanted to attempt to do early on in my career.
What accreditation taught me was how to be the best I can be in cosmetics, because it truly brings amazing growth to people.
So accreditation is considered an enormous achievement in our careers, but there is a next level. And the highest level of achievement in our academy is fellowship.
The confidence of patients being able to come in our door and know that I'm one of the leading providers within our area. So now I'm not just getting referrals from other patients, but now I'm also getting referrals from other doctors as well.
I feel extremely confident that when a patient comes to me with their cosmetic concerns, I am able to present various options and execute them at 110%.
When you tell your patients the process of what you're doing, from the smile design to the material selection to all the things that it has taken years to hone your skill set to be able to deliver to them, I think they appreciate that.
I feel like I'm a better dentist. I feel like my talent level is better.
Dr. Hetchko is a perfectionist, unlike anybody else I've met. He just strives for excellence and wants the best that he can give to all his patients.
My dentistry has changed, I would say, completely evolved in a positive way.
I'm very proud of him. It's been a long journey. He's put in a lot of work for this. It means the world to him. He has just been on cloud nine since we've been here.
The growth process from my first case before when I started accreditation to the last case I submitted for fellowship, it was pretty big.
The lessons I've learned in going through the process, the people that I have met, the lab technicians that have also taught me how to be a better dentist, those things are invaluable.
I'm so excited to be here with all my friends, all my family, and I'm here to celebrate Amanda and all these recipients for their fellowships and also the accreditation. So thanks.
AACD helps dental professional go further, faster.
It's just an outstanding thing.
So, with a vision, I entered this academy way back in 2008, and somehow I wanted to finish this. It was a great challenge, but we were able to finish this. And in the year 2014, I successfully finished. And right now, our president of the Academy of Cosmetic Dentistry India has finished after me. So this was that year. After that, I thought I will never do anything else in my life, but then this year I finished my fellowship, which is 50 cases. It's a journey. Why are we taking this pain and struggle? What is the necessity for me or anybody trying to do this is that it changed. My dentistry is evolved. Predictable. Practice productivity. My practice has grown like mad. Guys, it is an investment in the education which transforms us to another level of dentist. You're doing not the same dentistry what somebody else is doing. Not bothered who's practicing next to me or close to me. It is your dentistry that changed. After 10 years, 2014 I finished. Now it's after 12 years. Why do I have to take the struggle to finish the 50 cases? Is that the transformation that comes out, the education that's offered to you from this academy is something brilliant. So the whole transformation has moved us to start something in India. The affiliate of AACD is the Academy of Cosmetic Dentistry India, that most of you here are already members of it. So we proudly started this fellowship program here also. So I just wanted to go through the fellowship process because most of you have been asking that. So this is a curriculum to educate dentists to the next level of practicing cosmetic dentistry in the right way. So it's a 3-part examination. The first part is the written examination. The second is the core of the program, which is the clinical case examination. Then comes our oral exam just to make sure that you have done the work properly. And all cases have to be submitted through photographs. So theory is a multiple choice question. We are going to announce the date now at the end of this presentation. Those who are eager can immediately register by tomorrow once the link is ready. It's in September, I think. The date will be announced now. The theory would include all of this: smile design, photography, periodontics, including pontic design, stomatognatic system, that's occlusion, material science, adhesion, tooth preparation, including implants. So like I told you, it's a multi-specialty branch. We are not bothered in which branch are you. You're a super specialist, you're a specialist, you're a fellowship, undergrad, anybody can apply. Any practicing dentist from India and Asian regions can apply for this, and you take care of the theory. It's a percentile basis. We look at 70 percentile. So then you pass. There are a lot of people who have done this. At this year, we are expecting at least 5 people to get the fellowship. I'm just hoping because when Dr. Coyce is there, it will be a lifetime opportunity to get the fellowship from them. So let's hope people are able to finish. Then coming on to the required cases, just for you to know, this is stage 2. What are the cases we are looking at? There's 4 cases here in India. So can I use these cases for US exam? Yeah, we are evaluating with the AACD examiners. So in future, if you have that in mind, you can submit these cases also. So here it's only 4 cases. There in US, it's 5 cases. First is the entry level case, which day-to-day dentistry, everybody can easily pass, is 1 or 2 direct resines. And it can be a diastema, it can be a class 4 composite. Now, next is going to be 1 or 2 ceramic. It can be crowns or laminates. Then comes the chicks or smile makeover case. Either you do with composites or ceramics. In AACD, it will be both composite and ceramic. And type 4 will be your missing tooth replacement in an anti-aesthetic zone. So this is what we are looking at the cases. So please remember, it's not how beautifully executed, but what goes into diagnosis and treatment planning is the core. Even if your case is beautifully come out, if there is a flaw in treatment planning, that case will not be evaluated. That will be called as catastrophic failure in treatment planning. Is that right? So it's not how beautiful your case is, how well you've done your diagnosis and treatment planning is the first step. If there is a flaw in that, then there is no progress in treatment in case evaluation. So what are we boiling? That diagnosis and treatment planning skill of you will clearly tell how responsible you as a dentist, and that obviously gives you the predictable success. So obviously our job is to create a beautiful smile for everybody, and that's what we are looking at. But how stable and how successful these smiles are going to be is very, very important. So like I told you, it should be a balance of smile and function, and I don't want anything to break up here. So let's see the cases. So we would love to see the first case like this, a diastema closure, beautifully executed, or a class 4. I think these are simple cases to start off with. Like, you can finish these cases easily, and then it gives you a confidence that you can do it. So people are in the process know that it's not the perfection, it's a zone of excellence what we are looking at. So please remember that. Then your type 2 case comes with ceramics. Like no, but the ultimate thing is nobody should be able to find out what's been done. Your dentistry should practically vanish within the existing hard and soft tissues. That simply means your diagnosis is beautiful, you're taking care of the perio, you're taking care of the occlusion. It's your one picture will tell a lot of information to the examiners. So this is a case, 2 teeth, and then you have either a smile makeover with a resin, that's composite resin, canine to canine, and you also have a smile makeover with ceramics, that's canine to canine. So everything that speaks about your dentistry is seen in these pictures. So these are the cases what we are looking at. So please take up this challenge. It's a life-changing journey for you. And our theory exam is on the 6th of September. That's Sunday. It's online. So all you need is a good internet connection, a stable internet connection. The IT team will be there for the backup. It's a 3-hour exam on a Sunday, I think 10 to 10 to 1. And all our team will be there to take care of you. So the date is announced for this year. And then we go through with a lot of orientation. So guys, we have a lot of time to prepare, another 3 months to prepare. We are all there to help you out. Once you start registering, we will start the training session for the theory exam. So earlier, the better. So try to register for this exam earlier so that we give you a lot of study materials you can study with. And for all of you here, my only request is that please do not miss this year's conference. It's a 10th anniversary, but that's okay. Anniversaries keep coming and going, but this is going to be a lifetime opportunity conference. Dr. John Coy is the boss of stomatognathing system or occlusion who doesn't travel within the United States, is traveling to India. We spend, to be very frank, if you go to the website, you can see in Coy Center, For 1 week, we spend almost 15 lakhs, guys. We are offering that education to you 2 full days with Dr. John Coys at a price that is unimaginably less. If you're missing this, you're missing something. Because imagine we fly all the way around and spend so much to learn, and we are bringing him here and other 2 more great dentists. So it's not an opportunity to be missed. So please, before the tuition increases, I request you to register for this conference. And also tomorrow it will be open. It will be there on the Instagram. This video will also be recorded. It's already recorded. We'll try to make sure this is available to everybody. All the best, guys. Let's create a beautiful future ahead of us. Let's not people tell what is there in dentistry. There are a lot of things in dentistry. So thank you so much, guys. On a weekday, I pulled you out because we need to announce the date. So thank you so much for being here. If there's any doubts, you can always contact us. We are always there to help you out. So the dates is now, I repeat, the dates is September 6th, Sunday. So if there's any questions, I would like to take it up. You can unmute yourself and ask. Otherwise, we're all good to go. I'll just hang on for a few minutes. So you can also message us later, or you can message here, or you can also unmute and ask us a question.
So any particular last date for registration is there? Somebody was asking.
So we are open till August 30th. After that, we'll not be able to take up. So, but the earlier the better, because we will have some orientation happening. We will be giving study materials and sample exams. So I feel it's worth to actually register at the earliest.
Hello, sir.
Yes, ma'am.
Yeah, hi, sir. Actually, I had a glitch in the network, so I couldn't hear the September 6th thing. Can you just
September
repeat that
6th is
once
the
again?
theory exam. It's
Okay.
Sunday, it's online. So all you need is a good stable internet connection. It's all MCQs. So the registration going to open up tomorrow in our website, acdi.co.in.
Okay. And sir, about the contact session that is going to take place, any idea about that?
The contact session all happens only after you complete your theory and pass your theory.
So that I've done that last year. I've cleared it in December.
Then you finish your theory, right?
Yes, yes, I've finished my theory. But the
You're ready
contact
to,
session,
yeah, you're ready to submit your cases. We have our next month is case submission. If you're ready, you can start submitting.
okay, okay, sure.
Please, I'm the only mentor right now because everybody else is an examiner. So you can share the case with me. I'll tell you if it works or if it doesn't work. So those who are in the process, before you start the case, please share it with us. We will guide you through the treatment planning also. Yes?
Sure, sir. Thank you so much.
Thank you. So if there's no more questions, all the best, guys.
Hi, good evening, sir.
Yeah, good evening.
Yeah, this is Lalit, sir.
Lalit, good
Sir,
evening. How are you? Yeah.
I'm good, sir. Thank you very much, sir. Sir, I would like to know that how much follow-up is required for the cases in each
No
category.
follow-up, no
No
follow-up, no
follow-ups.
follow-up. It's
Okay,
just pre-op and post-op.
got it, sir. Got it. Yeah, thank you very much, sir.
Sorry, I didn't mention that. Sorry.
Hi, sir. Good
Hi,
evening.
Ganesha. Yeah.
Hi. So I just wanted to ask, so you don't need like the inter-treatment pictures as well for the
So
cases, like
only
during
for
treatment
composite
checks or
veneering,
anything?
we'll need inter-treatment pictures. For nothing else, we don't need anything.
Okay, so it's just
We will
the
need a
entire pre-op and post.
post-op radiograph. An
Okay,
implant
okay,
case, we need a pre-op radiograph.
okay, okay. Got it, got it.
I
Thank you.
just gave a brief on the cases. So once you pass your theory, we'll have a detailed orientation before you start your cases. So there are few cases which require some additional recording, and photography is a big
Okay,
thing. All raw images should reach us. So photographic documentation, what
correct.
are the required views? We will start that orientation once you're through with the theory.
Okay, perfect. Thank you.
Thank you.
So good evening.
Yeah, good evening, Dr. Gopi.
Sir, hi sir, how are you, sir?
Hi, fine, thank you.
Sir, regarding the exam orientation enrollments, how can we go along the study pattern, study material and all?
So once you register for the exam, that will start up. We'll start a
Oh.
WhatsApp group and then we'll start sharing you the study material.
Sir.
Then comes your sample questions.
Sir. Sure, sir. Okay, sir. Thank you, sir.
Yeah. Okay, guys, all the best. Please do come for a conference, and those interested can register. Message us. You can go to our website. It'll all be there. Thank you so much. Hopefully, I'm able to see you everybody in December.
Thank you, sir.
Thank you. Bye-bye. Bye.